Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about being induced in induction. So I assume that you've been informed that you're going to be induced, or maybe you're just thinking about it. When you've heard about that happening more often, I can tell you that the number of patients that we are offering to be induced has been increasing, and that's because there is some good data that says that we reduce your risk of a C-section if we do that between 39 and 40 weeks. Does that mean everyone needs to be induced? No. And does that mean that it's appropriate for everyone? No. You certainly need to get your particular case discussed with your physician. But let's say you do have a planned induction. There are two broad categories. One is to be induced with Pitocin because your cervix is what we call favorable or ready to go into labor, and another is to be induced with a cervical ripening agent, and there are many. Cytotec is one medicine, Cervidil. These are all prostaglandins that help initiate the softening of your cervix. So if your cervix is not what we call favorable, then we generally do that the night before. Again, your physician's schedule or your hospital might have a different timing or scheduling, but if you need this cervical softening, generally we do that the night before, and then you start on the Pitocin the morning of. So the cervical softening, so your cervix has some characteristics called the Bishop score, and there's a score that decides whether your cervix is favorable, and that just means how likely you'll have a successful induction and how long it'll take. So there are characteristics like how long your cervix is, and that's called effacement. So full length is this would be 50% efface, 100% efface is when it's paper thin. There's the softness of it. There's the position. So if this is the baby's head and your cervix is in front, that's where it's ready to go. But if your cervix is what we call posterior, that means when the baby pushes down, it's not pushing on the cervix, it doesn't dilate it up, and so you get a lower score with that. That's something that women who had many kids have more commonly. Then there's the dilation, and that's just how open the cervix is, centimeter dilated, and the more, when it's fully dilated, that's 10 centimeters. That's when it's time to have a baby. So you put all those together, and also one of the Bishop score, one more measure is how far up the baby is. So there's -3, -2, -1, 0, +1, +2, +3, baby's out. So -3 is up the highest. So you put all those together, and your physician will do that to give you an assessment of how far along you are. When you are induced, I generally encourage you to have a mild meal before, if it's the night before, nothing super spicy, because sometimes during labor you can get nauseous, so you want easier to digest food. Then there's a lot of variation by physician on the recommendations for you on whether or not you should eat before you're induced, like the morning of. And that certainly depends on your risk factors. Why are you being induced? Is it what's called an elective induction, just at 39 weeks, or are you being induced because you have a high blood pressure problem or diabetes issue or some other issue? So if you have an elective induction, then there is some data that suggests it may be okay for you to eat before. However, in my experience, women who do that have a lot of nausea and vomiting during labor. Not very fun. So my own personal suggestion, and you need to check with your doctor because your doctor may have a different approach to this, is if you want to avoid that nausea and vomiting, then just have a little water, and then when you're there in labor, put nothing in your mouth. Don't use suckers. Don't use even ice chips. Now that's controversial, and I'm letting you know that. That's my own personal taste. I let my patients who are low risk use ice chips, but I say if you want to avoid any vomiting, if that's something that you do, then not even ice chips, just use chapsticks to avoid the dry lips. You're getting IV fluids in your IV, and that will help you avoid throwing up during labor. So the risks and benefits for you are really something you need to explore with your physician. So there are definitely circumstances where being induced is of value. And if not anything else, all things being equal, most women are pretty uncomfortable near the end of pregnancy. And certainly it can save you a week or two and get to meet your baby. I also want to say that there's nothing wrong with letting nature take its course and to avoid being induced if you're low risk, if everything's going well and you're being monitored. So that is a personal decision between you and your physician, and I am in no way trying to say you need to be induced, you better be induced, or anything like that. So hopefully you find this useful, and I appreciate your time. Thank you.